All right. Well, good morning, everyone. Thank you for joining, taking time out of your day. I am Brandon White, and this is Mandy Furmanik, and we are known as Team Brandy. It's the easiest way to remember us. We are with CapFi Consulting, and we are your benefit consultants who help our West come up with the most competitive and attractive benefits. And today we are going to explain the plans that are being offered to you. And we're excited to announce that we're adding a HSA plan that we're going to go through, and you have the option of choosing between the current plan and the HSA. And so I'm going to share my screen now, and we're going to go through the first PPO plan. All right. Mandy, you are my guide. Do we see the screen?
I see the screen. Yes,
Well, then why don't you go ahead and explain the Classic 4000?
I would love to. Welcome, everybody. I'm going to go through the classic plan, as Brandon mentioned. This is going to be the most similar to what you have now. There are a few changes on this plan. Some of it is improvements. So I'm just going to briefly review what that plan looks like. At the very top, you'll see the total cost for the plan, and then you'll see the employee cost per month. And that would depend if you enroll just yourself or with a dependent. That's listed there. And as you do your enrollment through Employee Navigator, and I'll get into that a little bit at the end, you'll be able to see those costs as well. So you don't have to memorize this sheet or anything. So you have a deductible on this plan. It's $4,000 for an individual and $12,000 for a family. The out-of-pocket maximum on this plan is $7,150, and for a family, $14,300. So there are some changes there. I think the current deductible is $4,500. So the deductible is a little smaller on this plan. Just wanted you to be aware. The deductible runs on a calendar year, just as a reminder. So anything you've already met towards your deductible, you'll still have in place. Just because we're moving to this different plan, that doesn't mean you're going to lose that deductible amount you've already put forward. 30% coinsurance on this plan. So when there's not a copay involved, you will have usually deductible and coinsurance on those inpatient hospital visits, things like that. Preventive care, as a reminder, it's covered in full. So I want to encourage everybody to go make your preventive care appointments. That would be your well child check for dependents, or your mammogram if you're a female, or your annual exam. So those things are covered at 100%. The primary care office visit copay on this plan is $35. So it's a little cheaper on this plan than it is right now. And also for a specialist on this plan, still a $35 copay. So that's a huge win. I think you guys had like a $70 copay for a specialist. So there's some advantages to this plan. Just as a reminder, when you have that office visit copay, you don't have to meet deductible expenses. Virtual visit is a great option, and I'll go into a little more detail on how to do that, but there's different tiers and levels of a virtual visit. It's either $10, $35, or 30%. It's more expensive if you want to go into your doctor and do a virtual visit that way. If you use the program Doctor on Demand, that we'll talk about a little bit later, that's where you're going to get the $10 or $35 copay for that. Urgent care is at a $35 copay on this plan. And as we go into the hospital services, the inpatient is 30% after deductible, very similar to how your plan works now. Outpatient, same 30% after deductible. Emergency room is a little bit different on this plan, $100 copay, and then 30% after the deductible is what you would pay. I just want to put a little plug in to remind you all that an urgent care is a great option unless you're having a true emergency. I know there's just a lot of times that maybe you think that the emergency room is going to be the fastest option. It's not. And it's also a lot more expensive. And so if there's something that you can handle at urgent care, I would encourage you to do it. Again, if you're having a true emergency, please use the emergency room. So for labs and x-rays, 30% after deductible. And for complex testing, that would be like an MRI. something like that, 30% after deductible. You have chiropractic and acupuncture care on this plan, and that's a $35 copay. And then the prescription drug tier is working very similar to how it does now. So it's tier 1 is a $10 copay, tier 2, $35 copay, and tier 3, $75 copay. And then there's a tier 4 specialty, and it depends on where that specialty drug falls into the tier as to where it will go. So the other thing I'll point out is you have an EAP, which is an employee assistance program. After Brandon reviews the HSA plan, I will go into a little more information on the EAP, just as a reminder, because it's a great resource. You have 4 visits per incident per year. So I will go into detail with that. But generally, that's just the summary of that plan. And I will kick it back to Brandon for the HSA.
All right, thank you. Now the fun really begins. So fortunately, we've added an HSA plan, which is good. This is the fastest growing plan in healthcare. The HSA stands for Health Savings Account. And the way to look at this is you have a medical plan, and then you also have a bank account that you can contribute to tax-free, pre-tax, that allows you to use those funds that are not covered under the plan. And there's also other things that you can use to pay for, and I'll go through that in a minute. But the idea of an HSA, first of all, is it's a lower premium plan. So you can see here that if you pick this HSA, your contributions are less. And then if you want, you can put aside money into your HSA monthly out of payroll. And of course, again, this is going to be pre-tax. And you can build up that account throughout the year. I'll go through some of the logistics of it here in a second, but I want to go through the benefits. This is something that's very important about HSAs, and most people forget, is that in an HSA plan, everything is subject to deductible. This is required by the IRS. For it to be pre-tax, everything has to be subject to the deductible and the benefits. So you do have to satisfy a $5,000 deductible individual, and then a $10,000 for family. And then the out-of-pocket is $7,000, and then the family is $14,000. So for example, and I'll start with the only item that is not subject to deductible is the preventive care. Like Mandy explained, this is your chance for getting your exams, your preventive exams, your physicals, your mammograms. All those are covered 100%, not subject to deductible in the HSA. So we highly encourage this. The one thing I will tell you is a lot of times when you go in for your preventive care, if they are going to look at something else, perhaps you've got a mole on your back that you want them to take a look at, they are going to change the diagnostic code where it no longer becomes preventive. So we hear this a lot where people have gone in for a physical and then they get a bill and they're wondering why. Well, it's because they looked at something else or they did a refill on a prescription. So advice, make sure when you go in for your preventive exam, that's all that you're having done, and then it's covered 100%. And that does include any blood work. So if they're drawing blood for your exam, that's all covered 100% as well. So if you're going into a primary care physician for something else, then you are going to pay the full cost of the visit up to the $5,000 deductible. Remember though, it's Regents does have a contract with providers, and so there is a discount that will be applied. So I highly recommend if you go on the HSA, do not pay the visit until it's been processed, because they will apply the discounts and then the remainder will be your responsibility. Now, some providers will require some type of payment at the time of the visit. That's fine. But I would not pay the full cost because the discounts should be applied. Most providers are aware of HSAs and they won't require you to pay for the whole thing. And so It could take a couple weeks for you to finally get the bill. Same with specialists, that's subject to deductible. You're paying the full amount until you hit the deductible. That's 20% after you've hit the deductible. Virtual visits a good way to go in HSA. It's going to cost you less than going in person. If you do see a primary care physician, it's 10% and then 20%, and that it's subject to deductible as well. But the cost of it will be less than if you went in person. Urgent care is the same, subject to deductible. Hospitalization, emergency room, lab and x-ray. So hopefully you're getting the theme here. Everything's subject to deductible. And then once you've hit the deductible, it's going to cover 80% and your responsibility will be 20. Then if you hit the out-of-pocket in this calendar year, which by the way runs from January to December, I know that we renew September, but as a reminder, these benefits are on a calendar year. If you've hit the out-of-pocket of $7,000 as an individual, then you're covered 100% going forward. Everything's covered 100%. Doctor visits and even prescriptions will be covered 100%. Something that I will also add on prescriptions, because it's subject to deductible in the HSA, I encourage you to download the app GoodRx. Maybe some of you have already heard of this. You have it downloaded. This is a great tool to use because GoodRx does show you exactly where you can get your prescription at the lowest cost in your area. It'll even give you a proximity of a certain mile range of where you could go to get that prescription at the lowest cost. I will tell you, GoodRx beats the insurance probably about 50% of the time. You just need to be aware if you use the GoodRx, and what it does is it supplies a discount card to show at the pharmacy. If you use that, it's not going to be applied to your deductible or out of pocket because you're not having to go through the insurance. So just be aware of that, but test it out to see if it does save you money. So those are the HSA benefits. By the way, if you have any questions, feel free to use the chat. And Mandy and I will be checking those to see, and we'll be answering those. So if you have questions on either one of these plans, feel free to use the chat. Before I go into more of the other benefits, I'm going to skip down to the HSA again and some things on the benefits of that plan. So the first thing to remember in an HSA is that as you build up this account, this is your money and you never lose it. It's not a use it or lose it like an FSA. This you can build up year after year. And again, it's your money. If you were to leave our West, that money goes with you. And so it's important to remember this too, that this is your bank account. You will have to monitor your bank account. Nobody else can. Nobody at RR West can help you with this HSA bank account. We as your benefit consultants can't either because it's tied to you under the federal regulations. And so you do need to manage this on your own. As a reminder, it is tax-free. This is just kind of an example of the tax saving potential. If you're an individual, you will save around $830 a year. If you're a family, you're going to save about $1,600 a year in taxes if you contribute to the HSA. The IRS limits on the contribution each year because it's pre-taxed. If you are an individual, you can contribute $4,150 into the HSA account. And if you're a family, $8,300. Now, one of the loopholes is that we are starting an HSA in September. Because this is a brand new plan for RR West, you actually could contribute the full amount for 2023 if you choose to. It's the only time that you can do the full amount in a short period of time. But it's up to you if you want to do that. And then next year, starting in January, for the 12 months, you will be able to contribute the $4,150. Also, if you're 55 and over, congratulations, you get to kick in another 1,000. It's a lot like your 401k plan. It's called a catch-up provision. So you can do 5,150. Now, just some examples of what you can use your HSA funds for. Obviously, prescriptions, doctor visits, dental, anything, vision. There are some over-the-counter items that you can use it for. So there's a lot of things there that aren't covered under the plan, the insurance, that you can use your HSA funds for. And again, if you have to have money in the account to use it, so you can't buy the items off of credit and then later have money in there. You have to have money in the account to use for those expenses. So just so you know, Regions partners with Health Equity. This will be the name of the bank that you can set up your bank account with. And it's pretty easy. You'll go into their website, and we're going to be sending this information out, but you will see here the logon information. This is where you'll create your username and password. And as a reminder, you have to do this on your own. You will then get a debit card, and that debit card is a smart card, so you'll be able to use that if it's eligible for the HSA. So if you're at the pharmacy and you're getting a prescription, you can use this debit card. If you're at Walmart and you're trying to buy groceries, the debit card's not going to work. If you're at Walmart at the pharmacy, it's going to work. So it realizes what is eligible for each item that you're trying to purchase. And again, if you have the money in the account, that debit card will work. It's a lot like a 401k. You need to add a beneficiary and that type of stuff. You can put in there how much money you want taken out. And I believe that'll be Employee Navigator as well, Mandy.
So I do want to mention that in Employee Navigator, you can select how much money if you want to contribute to your bank account, but that's not the final step. Just because you elect that in Employee Navigator, like Brandon's saying right now, then we will send that enrollment over to Health Equity Bank. Then they will send you this debit card, and then you will need to activate your account, your bank account, and also select the amount that you want deducted from your paycheck. Because every month Health Equity Bank will be sending a report to the R West to let them know how much you've chosen. So there's 2 steps on that contribution.
Okay, thank you. Couple other things is you can transfer an existing HSA. So if you've had one from a prior employer, you can transfer it over to this one, the funds. Also, if you get to a certain account balance, you can also put a portion of your money into investments, and they have a lot of options there. Mutual funds, stocks, that type of thing, just like a 401k. They do require a certain portion, though, into the cash account, so you can use that for the eligible expenses. But that is an option as you build the account. The one thing that we do have to determine is if you're eligible for the HSA. The IRS does require a certain amount of things to make you eligible. The first is you have to be enrolled in the HSA plan with R West. So you can't enroll in Classic 4000 and then try to set up the bank account. You have to be enrolled in that HSA plan, which also means that you cannot have other health coverage. So you can't be enrolled in on another plan if it's with your spouse and go on to the HSA. The IRS just doesn't allow that because of the pre-tax benefits. Of course, you can enroll on the Classic 4000 and have coverage somewhere else. It's just pertaining to the HSA. The other thing that really gets people, and this is coming up more and more because we're aging, if you become eligible for Medicare at the age of 65 and you go on Medicare, you have just made yourself ineligible for the HSA. IRS does not allow you to be enrolled on Medicare and an HSA. Why? There's really not a reason. It's just their regulation. So if I were you and you're 65 or getting close to 65 and you want to be on into the HSA and contribute, then decline Medicare. Now, there is a myth there that a lot of people say, well, I thought I had to take Medicare. The answer is no, you do not have to enroll in Medicare. You can decline it if you choose to stay on your HSA. If you do go on Medicare and are on the HSA plan, you can stay on the plan, you just can't contribute anymore. Final thing is you cannot be a dependent on someone else's tax return. So if you are under the age of 26 and you're on your parents' plan, you cannot contribute to the HSA plan. So those are kind of the kickers there. Make sure you look at that. If you do accidentally enroll on the HSA and make contributions, you're going to get that money back and you're going to get taxed. All right, Mandy, maybe I pause here to see if we have any questions.
We do. We have a host of questions. So I will start with the first one that says, can you explain the differences between out-of-pocket costs and deductible costs? Yes.
Yes. Do you want me to do that?
Either one.
Go ahead, Mandy, you do it.
Okay, so there are deductible expenses and things that apply to that 4,000 if I'm looking at the classic plan deductible. But when I go to a primary office visit, I have a $35 copay. So there's no deductible included in that. But when I go to an inpatient hospital visit and I have 30% after deductible, that's the coinsurance, and that's rolling up to that out-of-pocket max. And just to make it even more confusing, your deductible also is included in that out-of-pocket max. So that $7,150 for an individual is 4,000 of that is deductible, and the rest of it is any copay or coinsurance that you're paying is rolling up to that out-of-pocket max. So once the entire thing is satisfied, which means 4,000 of the deductible and the remaining amount to equal that $7,150 for an individual, then everything would be covered in full for the remainder of the calendar year. Does that help?
I think so.
I put that out there just in case anybody was confused, because I originally was confused when I started healthcare on that.
Well, and we talk about it like everyone should know what that means. You're exactly right. Okay,
which is a good point on the HSA is that the 5,000 is included in the 7,000, right? So you're only having to pay an additional 2,000. I shouldn't say only, 2,000's a lot, but yeah. Once you've hit that extra 2,000, you're covered 100% after that going forward.
Okay, what else? So the next question is on PPO virtual visits. What is the difference in the prices? Because there are 3 tiers listed there. So I did want to clarify that. Thanks for asking the question. So when you call Doctor on Demand, if you use the vendor, it's a $10 copay per visit. That's the vendor there. $35 copay is the in-network non-vendor provider. So if you were to use another vendor, which is outside of Doctor on Demand, it would be $35. And then if you want to have a doctor visit with, say, somebody at a facility that you go to and you want to set up a virtual visit, it's 30%. So those are kind of the different ways that you can use a virtual visit. You can use it all 3 ways, but we would recommend that you use Doctor on Demand because that's Regence's vendor and it's cheaper. Okay, there's more. Can you use the HSA for things like orthodontics and oral surgery, or only things that go through Regence? Excellent question. Brandon?
The answer is you can use it for anything like orthodontia and it does not have to go through Regents. So if you're on the principal dental or vision plan, you can use the funds to pay for things that are not covered under the benefit. Also, you can use HSA funds, your funds that you've contributed to perhaps your spouse's plan that is not covered. So it does allow you to use those funds for other expenses that may not even be associated with the Regents plan. So that is kind of the nice thing about it, is that you can't be on two plans, but you can use the HSA funds to cover other expenses under another plan. You might be thinking, can I use HSA funds to pay for premiums? No. Okay, so you can't use it for your dental or vision premium or your spouse's premium. Only expenses not covered by the plans.
Okay, next question. HSA plan, with that deductible, the insurance doesn't pay for anything that is not preventive health until I pay $7,000.
No, until you pay $5,000. So you hit the deductible of $5,000, then you're getting the co-insurance where you're paying 20%, plans covering 80%. Once then you've hit the out-of-pocket, which is already including the $5,000, it's then covered 100% going forward. So here's kind of maybe a moment to talk about the two plans and the differences and why I would choose one over the other. They're pretty close to the out-of-pocket max. You're paying a little bit more on the classic 4,000. But if I was somebody that did utilize the benefits, and I know I've got some costs or some procedures coming up, I'm probably going to pick the HSA plan, because if I know I'm going to hit the out-of-pocket, I'm going to be covered 100% anyway after that, and I can still contribute to the HSA plan, and it's a lower premium. So if I know I'm going to have a lot of costs, I'm probably choosing the HSA. If I don't have a lot of costs, and maybe I go to a doctor once or twice and I have a few prescriptions, I'm probably picking the HSA. If I'm kind of in the middle there with the claims, I'm probably picking the classic 4,000. Or if I have some dependents on the plan that may, use the doctor 5-6 times a year, and I'm not going to get to the out-of-pocket, I'm probably picking the classic 4,000.
Okay, next question. Do we manage the HSA internally, or does someone else do that for us? I know we did touch on that, that it's your bank account. So you would be responsible for setting it up with Health Equity. Once you've enrolled in the HSA plan with Regents, then you would need to finalize that by opening the account online and then making sure that your deductions, contributions are set online there, as well as an employee navigator. What does employee plus children fall under? Individual or family? Family.
Family, yeah.
Is there a way to anticipate lab costs? When I receive a bill from LabCorp, Quest, or Sunrise, I see that there's an in-network discount, but I'm still owed an out-of-pocket cost. Is this how the doctor codes each test, or is there a general way to understand costs ahead of time?
That's an excellent question, and really a good point on what we should be doing as health consumers, because that not all costs are created equal when it comes to providers. So yes, they should always be able to give you an estimate of the procedure, regardless if it's an x-ray or if it's a procedure. You should be getting an estimate of what it's going to cost you. You will also then, you'll see the discounts applied by Regents, so you can understand your final responsibility of payment. When it comes to lab and x-ray, here's kind of a tip. I mean, if you're going to go to the big name brand providers like a Providence, you're going to pay a lot more versus a LabCorp or a Quest. you're probably going to end up paying 50% more out of Providence. Legacy, maybe a little less. OHSU is going to be expensive. So you have the option a lot of times to choose where you want to have the lab and x-ray. I know it's a convenient thing. If you're at a hospital or you're at a Providence system, they just want you to go down the hall and get that taken care of. That's fine, but you're just going to be paying more if you were to go outside of that and go to a third party like LabCorp or Quest. So that's something to consider.
And if you do go to regents.com and set up your member account, hopefully most of you already have that, you can do cost estimator tools there. So if you're looking to compare pricing for labs, you can do that all online at regents.com with your member account. The last one we have is under HSA. Do you have to participate in the HSA bank account, or is that optional? No.
That's optional. You don't have to, you don't have to contribute. If you just want to be on this plan, that's perfectly fine. You do not have to set up a bank account.
Great question.
Any others? Yeah.
So no, that's all we have so far. So
okay,
you're going to go on to the dental and vision.
I am. All right. So this is staying the same with principal, no changes. So that's a great thing. And again, I should have hit on it. There's been, it's been a tough year in healthcare. We always seem to say that now for the last 15 years, but it's true. It's been a tough year.
Every year.
So it's nice that we're able to stay with a lot of the same things, regions, principal, and having at least the same plan as before. So the dental plan is staying the same. Deductible is $50, individual, families $150, and you get up to $1,500 per calendar year towards the benefit. And again, this resets in January, so we encourage you to get all that done before the end of December. If you're going in for an exam, it's no copay to you, and you get you get two every year. So preventive, the deductible is waived. You're covered 100%. If you have basic, which would be fillings, then you're paying 80% after the deductible. And then if you're having some major work like crowns or root canals, wisdom teeth, you're covered 50% after the calendar year deductible. For vision, just a reminder of the benefits here. We encourage you to use it. It's a $10 copay for the exam, and you get one every 12 months. If you need glasses, it's a $25 copay, and you get up to $150 every year. So obviously, if you're going to an optometrist and you're buying glasses through them, it's going to be more expensive. That $150, it's not going to go too far. It'll be able to get you a decent set. But if you're looking to go at a more affordable, then we encourage like a Costco, Walmart, that type of thing, where that $150 will go a lot more. The copay or the glasses coverage is every 12 months. And this includes the different lenses that you may need for vision. So that is the dental and vision. And now a reminder on the life and DI. Mandy, take it away.
Yes, this is a commercial on the life and disability. So your benefit package is really strong, as you can see with our West. These next benefits that I'm going to review are voluntary, which means you pay 100% for these benefits if it's something you want to participate in. They've been in place for a while. So as a reminder, you have voluntary life and accidental death and dismemberment coverage. If you want to participate in that, you can. If this is going to be the first time you're wanting to participate in this and you've been an employee for a long time, you would have to complete something called a statement of health. So, but if you're already enrolled in this, you're already participating, and you want to add 2 increments, which $10,000 increments of voluntary life insurance, you can do that at this time because it's open enrollment and you're already enrolled in the plan. So that's just a reminder, you don't need a statement of health if you're already enrolled and just want to do the 2 additional increments. Voluntary short-term disability is also available. It's going to pay 60% of a weekly earning up to $1,000 maximum. This is going to be the pricing is based on your age and salary information. So as you're walking through the enrollment site at Employee Navigator, you would be able to see what the cost would be if you want to enroll in this. If you're not enrolled in this now, it would require a statement of health. So there is some follow-up paperwork. Voluntary long-term disability, same thing. This is for something after, a certain amount of time, like 90 days after you've had some sort of maybe surgery incident, something ongoing health-wise, you would get 60% of your monthly earnings to $1,000 max. And that cost also varies based on your age and salary. So again, this will be personal benefits to you, and you will be able to see those calculations as you walk through the enrollment platform, Employee Navigator. You also have critical illness coverage. There's different tiers. You can also enroll dependents in this. Coverage is also based on age and benefits that are selected. This also would require a statement of health if it's something that you're not already enrolled in, but it would be giving you some coverage for some really critical long-term things that could happen. And you would have certain amounts that you would get paid as a benefit if you were to have some of these illnesses. There's also accident coverage. That one doesn't require the statement of health. And so that you can enroll yourself or with you and a spouse or with a child. And again, the cost varies based on your age. So that detail is going to be all in Employee Navigator. You would be able to read what the benefit pays if something happens, what you would get. So I encourage you to take a closer look if it's something you're interested in. That's all available on Employee Navigator. Okay.
We're almost to the final stretch.
Okay. Hang in there, people. It's almost done. This is the really good part. We saved the best part for right now. It's the Employee Assistance Program. And I just wanted to remind you guys that it's available to you through Regents. And you can have the 4 visits per incident. And they have a lot of ways that you can chat with a professional. And it could be confidential counseling. There's a 24-hour crisis help. There's online consultations, peer support groups. There's lots of different ways that you could utilize the EAP. The other thing that they have is work-life services, which would be identity theft recovery. So you could get support with any sort of credit incident. There's legal help where you could have a half-hour consultation at no additional cost to you. And then you would also get a discount if you want to follow up with more legal services. Mediation, financial help, online legal forms. If you're looking for just anything as far as contracts, leases, resources like that, it's all available through this EAP. So again, we'll make sure that this is, there's a phone number that you can call, or you can go to uprisehealth.com/members. I'll make sure that this flyer is loaded in Employee Navigator so anyone can access this. And I just want to remind you that it's available to just have some additional support and resources if it's something that you need. Okay. I think the next flyer that I'm going to review is just a reminder about telehealth. And we did talk about that as far as the virtual visits go, if you want to see a medical doctor. But you also could see a behavioral health care specialist. If that's somebody that you want to contact through Doctor on Demand, you can do that. And it's 24/7, 365 days. So it's a great option. I know a lot of times if you have children and it's kind of hard to coordinate to get somebody into a provider, and you're looking at your kid and they have pink eye, a virtual visit is a great way to do that. But also can help you with behavioral health, which I think isn't a great option if you're having some anxiety, some depression, some kind of issue, and you just want to talk to somebody. You can use your virtual visit for that. So just wanted to remind you it's out there. And even if you're on the HSA plan, the virtual visit is also going to be a cheaper option than actually going into a provider if it's something you can handle virtually. And all of these resources are at regents.com, which hopefully you've registered for. And if you haven't, you can do that as soon as possible. Okay. I think there's another
We have
question.
one. I've been reading them, Mandy,
Okay.
while you were
Talking, you weren't listening. Okay, go ahead.
Oh, I was listening and reading. So it's a good question. It says, what does a vision exam entail? And I think what they're asking is if I see an optometrist for redness in eyes, irritation, sty, etc., would I then pay for a specialist in my medical plan? So yeah, there are. So first, the vision exam, it's going to include your routine testing. They're going to obviously do the whole dilating of the eyes, your reading of the screens, and all those things to determine your vision. If they go into more of a diagnostic visit, it depends on how they code it. So this is kind of goes back to the coding. There are times where it would be covered under medical, but it's all on how they code it. So you would have to make sure if you're visiting your optometrist and they're going beyond the normal vision screening, that you're asking perhaps how it's coded under vision or medical. Because if it's covered under vision, you're probably going to have a balance bill situation. If it's covered under medical, then it could turn to the specialist copay. Unfortunately, we can't predict those. It's just all in the way that they code them. So I believe that is it for the questions.
I have more things to say.
Please,
I know,
Annie.
I know you're shocked. I just want to remind everybody that you will enroll or waive your benefits through Employee Navigator. The email actually went out this Monday, and the email comes from Employee Navigator. So if you have not received that and you looked through your junk email or are still wondering where that is, please let someone know so that we can resend that to you. But that's how you will enroll or waive in your benefits. It will show you what you're currently enrolled in. I know a lot of times from year to year, you kind of forget. It's going to show you what you're currently enrolled in, and then you need to select what you're going to be enrolled in for the new plan year, which starts on September 1st. So I just want to remind you that every single person will receive a new ID card. And that's because the current plan you're on is changing to this classic 4,000 plan. And then, of course, if you elect the HSA plan, you'll have a different ID card. So once we capture all the enrollments and waives, and the portal will close on August 30th. And once we've captured that and sent that over to Regents so that they can know what plans you're on, then they will release new ID cards for everybody. And you'll want to make sure that you look for that in the mail within 10 days after everything closes down. And it'll come to you in a white envelope, and it won't say, "Hi, this is from Regents," and your ID cards inside. So please just make sure you look through that so that you don't miss the new ID cards that'll be coming out to your homes. So please make sure you look at the email from Employee Navigator, click on the link. If you haven't registered, register. If you're already registered, put your username and password in and just select the benefits that way. And all the information will be there on Employee Navigator as well. Okay, now I'm done talking.
We got another question here. A good question is when can I start contributing to the HSA account? You can, once you've registered on Health Equity and have established the bank account there, the following payroll, it should be processed where it will go into that bank account. So it's all about, if you set it up sometime here in August, I'm gonna say that you're probably gonna have to wait until the second payroll in September. I think there'll be a little time that it'll take to get everything set up, but I would count on probably second payroll in September. You should see the money start going into that bank account. All right, it's 9:46. I believe this is it. Thank you for everyone for joining, and we hope you have a great rest of your week. Take care.
Thanks, everyone.
Thank you.
Bye-bye.